Maryland. And the still directors wanted to, reach out to everyone during this very difficult time that we're all going through. The disability community, our goal is basically to be in charge, to be independent, and to have control of our life and our future. So we felt that bringing some speakers in and, letting everyone know what's going on in the disability community was just a good thing to do in Maryland. As you also know, Centers for Independent Living, we truly are the gateway for information, referral, and services for the disability community, and we're peers. So we are people with disabilities helping and advocating people with disabilities, which is a huge, huge asset to us. So I'm not going to take up any more time. I'm going to turn it over now to Sarah Basehart, and she's going to introduce our speaker for today.
Thanks, Lori. Welcome, everybody. So hopefully this is, you are joining, in fact, to hear from Randi Ames, who's a lawyer at Disability Rights Maryland. She joined Disability Rights Maryland in December of last year, so newer at their organization. As a reminder, for those who aren't familiar, Disability Rights Maryland is the protection and advocacy agency for people with disabilities in the state. So it's where many of us turn to when we have legal questions, need to make referrals of our consumers to get legal advice that's very specific to disability issues. And Randi's working on the housing and community inclusion team. She worked at Legal Aid before she came to Disability Rights Maryland, and she was a statewide long-term care assistance project staff attorney. So she worked on a lot of nursing home involuntary discharge cases and access to healthcare coverage and eligibility issues. So she's quite familiar with many of the issues that the Centers for Independent Living work on in Maryland. And her interest is in access to healthcare. Her interest in access to healthcare issues began when she was a volunteer associate with the Department of Health's Medical Assistance Program. So we're going to welcome Randi, and I'm going to turn things over to her. I'm going to just, as a couple quick logistics, I want to remind people to put their questions in the chat box. If that's not accessible to you, please raise your hand and I'll do my best to keep an eye on the hands raised. But the easiest thing to do is to hit that chat box and type your question in there. If you want to make sure you can see Randi, because there are over 50 people on this call and it can get tricky with all the screens to see, in the upper right-hand corner, you're going to click speaker view, and that will make sure that the biggest picture in your screen will always be the person who is speaking. So right now it's me. Soon it will change to Randi when she starts talking, and then back to me as we take questions. But sometimes people prefer that view. So I'm going to go ahead and kick things off. Welcome, Randi.
Hi there, everyone, and thank you so much for having me. I hope you all know that Disability Rights Maryland, how much we value and cherish our connection and relationship to the statewide SILs and your consumers and the consumers that are on the call. As Sarah mentioned, we're the Protection Advocacy law firm. We're the federally mandated program in Maryland. Our priorities are serving people with disabilities and legal issues, a wide variety of legal issues. So today what I wanted to do is, one, just introduce myself to you all, and also to give an overview of the areas of practice at Disability Rights Maryland, just kind of a general overview, as well as our intake information, and just highlight some of our COVID-19 advocacy work. Our teams have been doing a wide variety of great work, but I just want to highlight a few of the projects that we've actually been able to work on with some of our SIL partners. So some of you may already be aware or familiar with some of our advocacy letters and advocacy work already, but this is just an overview. Really, it's our goal that people with disabilities live the most integrated and lives possible with the community. And so we're trying, with COVID-19, obviously some very unique barriers have come about. So we're trying to address some big picture advocacy work and policy work to ensure that to the best of ability, people are still able to access their community and their services as much as possible. So to begin, just generally, Disability Rights Maryland, we have several different teams, and I'm just going to go over some of the cases, what that looks like that we work on. We have a developmental disabilities team, and they focus on issues related to eligibility and services through Maryland's Developmental Disabilities Administration, DDA. So they'll work on issues related to losing eligibility, accessing eligibility, and maintaining services or reductions in services. Similarly, our Medicaid team, our medical assistants in Maryland, they address issues related to eligibility, access to services, coverage, and general, issues with reductions of services as well. We also have our mental health team, and they focus on individuals in psychiatric facilities throughout the state regarding access to care, forced medication, as well as discharge planning, as well as rights while in the facility. Our public benefits team works on Social Security issues related to working, ticket to work programs, as well as overpayments due to working, and ensuring that individuals who are able to work but still require Social Security services are able to maintain those benefits. Additionally, we have our housing team and community inclusion team, which I'm part of, and that focuses on accessible housing, ensuring access to housing for people with disabilities, as well as maintaining housing. So we handle eviction cases related to discrimination with people's disabilities, as well as issues related to reasonable accommodations, the need for reasonable accommodations in housing. Additionally, we have our education team, which focuses on school discipline. There's high rates of individuals who, higher rates of people with disabilities facing expulsion and suspensions. So our education team focuses on that, as well as developing, ensuring educational assistance through IEP programs, as well as services in and out of school to ensure that students are able to get a full education. Additionally, we have our transportation team, which works with issues regarding MTA mobility, both eligibility as well as maintaining services and issues with services. So if individuals are facing discrimination in using MTA mobility, as well as complaints regarding access to services. And finally, we have our voting team, which supports people with disabilities' right to vote and accessible voting. And finally, we have our inmates' rights team. So those are individuals that are currently incarcerated, ensuring that they have access to health care and their rights are respected while incarcerated. So currently with COVID-19 going on, we are still operational. Our firm, we are working remotely. However, our intake staff, we have 2 intake specialists, are still accepting intakes by phone. And that number is 410-727-6352. And you select extension 0 to be connected with one of our intake specialists. If you're not able to get directly through to one of our intake specialists, if you leave a voicemail, both of them are very diligent in an attempt to return calls within 24 to 48 hours. So I'm going to just move on and just kind of give, again, just a general overview of some of our COVID-19 advocacy that we've been working on. So one area that we found, of course, the greatest need is with healthcare related issues during the pandemic. So we became aware that hospitals across Maryland were instituting hospital visitation policies, which were discriminatory to people with disabilities. That a lot of hospitals were putting in place a strict no visitor policies. So along with our partners, we sent a letter to the Secretary of Health, Neal, requesting a reasonable accommodation for people with disabilities who need assistance due to their specific needs. So we were asking for at least one visitor to be allowed at a time, that restrictions that any restrictions regarding visitors be clearly explained both to the patient and that support person, as well as procedures to train staff and current patients to understand why that there were reasonable accommodations for individuals who needed visitors. So on May 11th, MDH issued a notice on visitation policies that went into effect on May 22nd that incorporated what we were requesting to allow one visitor at a time when the person with a disability needs a reasonable accommodation, to have that person to assist them with making medical determinations or support in order to fully access their health care. Another point we'd like to highlight is we were concerned about crisis standards throughout Maryland being in place that would result in rationing of resources, in particular ventilators, but also testing and just services and care in general. So we provided a letter to Governor Hogan requesting policies that direct medical providers to refrain from discrimination against people with disabilities and providing care during the pandemic. In particular, we were requesting that each patient be individually reviewed for their needs, that there would be an equal opportunity to benefit from any treatment available, and that providers would assume that they are not free of biases in order to be able to be conscious of those implicit biases when treating patients with disabilities. And particularly, we asked that ventilators not be reallocated when a person who requires a ventilator daily for their care and they seek treatment for COVID-19, that ventilator not be reallocated. So at this time, we haven't gotten a response from Governor Hogan. However, we have been invited by several different ethics groups to kind of give some guidance and technical assistance and understanding of the policies we were requesting, and those policies and procedures are still being developed. So the team that I'm on, the Housing and Inclusion team, in particular, we were concerned in Baltimore City and highly dense population counties about high rises and public housing, as well as access to modifications that were already either being in the pipeline or emergency need for someone to safely reside in their home. So we've worked with several different housing authorities throughout the state in requesting, that policies and procedures and guidelines be put out to ensure that reasonable accommodation modifications are still being done, as well as the need for PPE. So in particular, the Housing Authority for Baltimore City, we've been in frequent contact with them, but wrote an official letter asking that PPE be provided to residents as a reasonable accommodation to ensure their ability to safely move about the building, as well as interact with staff as needed, and providing those reasonable accommodation modifications. So on June 2nd, the Housing Authority for Baltimore City has contacted us that they were resuming their reasonable accommodation modifications and are providing PPE. They received a large donation and we're making it available to staff, maintenance workers, and residents. And I apologize, I just want to go back to the point, the advocacy work regarding hospital visitations. So MDH has issued a notice on hospital visitation policies requiring that hospitals provide a reasonable accommodation of a support person to participate in someone's visit, whether that's a single visit or an extended hospitalization. If anyone is hearing complaints from consumers, or if you yourself are a consumer know of anyone who's been denied the right to participate in their either whether it's an appointment or at a hospital during a hospitalization, to have that support person with them. We are looking for referrals to provide technical assistance and become aware more of specific kind of bad actors in hospitals and healthcare facilities that are not providing those needed supports for people with disabilities. So moving on, we've also been, DRM has been working diligently with the judiciary and other organizations in access to justice calls weekly regarding the courts reopening, as well as, in particular, what landlord-tenant cases are going to look like when the courts are fully functioning. So the courts had reopened officially at 5 p.m. on June 5th, and then there's the phased reopenings for case types. So, you know, we're interested in advocating to ensure that people with disabilities, their due process rights are still being respected, and they're still able to access the courts, as well as, but balancing that with the need for accommodations depending on someone's disability and condition. So our voting team, with the primaries that just passed, we're very interested in ensuring that accessible voting and polling locations were available. In particular, the State Board of Elections had issued a notice originally that for District 7 for Congressman Elijah Cummings' term, that it was only going to be a mail-in vote. DRM, along with a lot of other organizations, advocated that a paper mail-in only ballot was deficient and on its face discriminatory. And luckily, through that advocacy work, the State Board of Elections did revoke that decision of to provide only mail-in ballots. So this is an issue that DRM is keeping close eye on, especially with the upcoming elections. So if anyone is aware of a participant or a voter who faced barriers during that special election on April 28th because of that initial mail-in only or the limited polling locations, we're interested in hearing from voters so that we're better suited to kind of address some of the issues as coming up in November. So we're really interested in hearing from you all and are open to referrals on those issues. And I know some of you participated on this call when it was more limited to just the Image Center, but our litigation director, Lauren Young, provided an overview about MTA mobility. So kind of as soon as COVID-19 really started gearing up, it was clear that there were issues with transportation and questions about individuals being able to continue their access to paratransit services. And that's where DRM continued to advocate to ensure that essential travel services were still in place for things like healthcare needs, transportation to grocery, banks, pharmacies, and providing essential services such as caregiving. And again, similarly, if any consumers or participants are aware of rides being denied, please call us. We want to be aware that to ensure that our advocacy efforts are continuing and that people are still, that MTA is providing those essential services, essential travel services. Another large area for advocacy during COVID-19 was with education, with distance learning. Obviously, kind of school education, schools got turned upside down with being able to provide, no longer being able to provide in-person classroom experiences. So in particular, in Baltimore City, our education team requested that the Baltimore City Council provide for emergency financial investments for greater internet access and tools for support for distance learning. And we have seen that there have been some funds diverted and emergency funds towards that end. In particular, there's been a number of letters to the state superintendent, Karen Solomon, regarding school discipline as well as maintaining services for students. So when it comes to school discipline, we've requested that students that were previously suspended or expelled be reinstated, reinstated, and then that there would be a withdrawal and moratorium on suspensions and expulsions as distance learning continues. Additionally, there was a huge concern about continuing services for students with IEPs and need for additional services and supports, what that would look like at home. And that's been through both a concerted effort at the county and city level as well as statewide. So, directing individual advocacy through our clients with developing and implementing compensatory education services as well as maintaining services and support. And now that we're hearing that there will be some schools will be providing limited programs over the summer, ensuring that students with the most need are prioritized to be in those summer programs or limited programs that are returning to schools. Next, one team I forgot to mention earlier is we have a rep payee team who investigates, and that's representative payees for Social Security. And they represent neglect or abuse regarding financial abuse regarding representative payees who handle the funds for individuals who receive Social Security benefits. With the stimulus check that was issued, there's a number of both scams going on, but as well as misuse of stimulus funds. And we're seeing that in two ways. Facilities, nursing facilities, trying to or requesting that residents divert their funds to the facility, or representative payees, individual representative payees misusing those stimulus funds. So if anyone's aware of a representative payee issue regarding funds in general, someone's access to someone's Social Security benefits, but in particular with stimulus funds, please make those referrals to our representative payee program. And the next issue is decriminalization of people with disabilities. And this is related to healthcare, but we're seeing that, one, Governor Hogan issued an executive order for accelerated parole. However, under that order, it only addressed individuals 60 and over and didn't speak to anything about those persons with disability. So we've requested that order be amended to allow for people with disabilities that are higher risk to be eligible for that early, that accelerated parole program. Additionally, we've been in contact with the Behavioral Health Administration, both the Chief of Staff and the Chief of Hospital Administration. As the Protection Advocacy law firm, we have certain access authority that allows us to request documents in order to review facilities, policies, and procedures. We've done that with the state psychiatric facilities, in particular regarding their evaluations, what evaluations and their procedures for making evaluations and referrals during the pandemic. We've been informed through multiple complaints that competency evaluations are not being completed at psychiatric facilities, which are causing delays in release or transfer from psychiatric facilities, and we're requesting that competency evaluations be implemented as soon as practical, or immediately, I apologize. Additionally, individuals not found competent to stand trial are currently being held at jails rather than transferred to MDH facilities. and this is, the overextension of people having to be housed in the criminal justice system rather than being able to access the services and treatment that they require due to being found not competent to stand trial. So we're asking for the immediate transfer or release of those individuals. And finally, I know this is an issue that's been discussed quite a bit in this group, is access to food. Our litigation director sent a letter to business leaders through the Maryland Business Coalition requesting that they accept SNAP benefits for online orders. There has been progress with the state SNAP program being approved for online orders with Walmart, Amazon, and ShopRite. Again, we'd like to hear about any barriers or issues that are continuing with beneficiaries being able to use those services. There's a weekly standing meeting with DHS that we've been participating in with the Homeless Person Representative Project, as well as with DHS regarding the food access issues. So that's just a very kind of broad general overview of some of the bigger advocacy priorities that we've been focusing on during COVID-19. Other than that, and I apologize, I haven't been keeping an eye on the questions box.
I've got it. Okay, we're good. There are many, Randi, as you can imagine, already starting. The first question is, how do you know when someone in a psychiatric facility is in need of your services? Do you monitor these facilities, or do you get reports from family members if a client is needing DRM services?
Both. So under the Maryland Department of Health is required to inform an individual at a psychiatric facility of their right, if it's right to refusal of medication and their right to counsel in those cases. So we'll get referrals directly from facilities that assist the patient to contact us, and we'll reach out. So both that way, as well as complaints from family members in the community.
Thank you. Then we're going to take a question from Terry. So Heather's going to help me with unmuting Terry, but I want to remind everyone that if you have muted yourself, we are not able to unmute you. So Heather will unmute you now, Terry, but if you also muted yourself, you're going to have to hit it as well.
All right. Thank you. Thank you, Randi. A lot of this information is really very important. And I lost contact for about 5 minutes. And when I came back in, you were discussing what I was going to ask about, and that was the executive order put out on May 11th about access to support for people with disabilities in hospitals. A friend of mine had her husband went into an emergency Parkinson's issue, and the first week or two was not able to see him. Now, I'm looking at the executive order right now, which I'm very thankful that occurred. Are these two statements correct? Because this is how she interpreted it. If you have a disabled loved one in the hospital due to a non-COVID illness, Maryland law says one person can visit them anytime. And Maryland law also states that people with disabilities in the hospital are allowed to have one person 24/7 access for a healthcare advocate.
Correct.
They're correct?
Yes.
Oh my gosh, wonderful. Thank you. I appreciate that. That was an easy question.
Great. I'm going to read another one from the chat box. And that is, I was reminding people, there was a question about how is Disability Rights Maryland different from Disability Law Center? So I was reminding folks that that was your former name,
yes,
that you are now the organization known as Disability Rights Maryland. And so we're just refreshing on that. And then there's a question about when you were speaking about transportation, you mostly focused on mobility services in Baltimore. And so someone was asking, do you also work with the Regional Transportation Association, RTA, that serves, I believe they serve Anne Arundel and Howard County?
Yes. So we don't get as many of those cases. I think sometimes people think of us as a Baltimore City or Baltimore County kind of advocacy group, and we are the statewide Protection Advocacy firm, so we do cover other paratransit and transit programs throughout the state, whether it's accessing those issues with accessing the services or eligibility.
Thank you. Now we're going to unmute Beth Wiseman for a question.
Thank you, and I unmuted myself. Can you hear me?
Yes, ma'am.
Okay. Several years ago, I worked on trying to get accessible housing for all new housing being built, and Mike probably remembers it. It had a funny name to it, something about visitation was the name of the bill. What it was that every new house should have at least one entrance so that a wheelchair can enter. You remember it? You're shaking your head. And also,
Visitability.
what is it?
Visitability.
Okay.
Yeah.
Oh, right. That's right.
They were county bills, as I recall, but Randy may be able to speak to them.
Here, I'll turn on my video, Joe.
Okay, and then a bathroom should be wide, the door of the bathroom should be wide enough for a wheelchair to go through. And I'm wondering, has there we worked on it for, I think, 3 years legislatively, and I think it was the people that did the grading that said that it was impossible or too expensive or something. Anyway, obviously the bill didn't go through. And I'm wondering, have there been any updates on trying to do something like this, making new housing accessible for people with disabilities?
And again, I've only been a housing attorney since December. Under the Fair Housing Act and with federal regulations, new construction need to have particular accessibility features. But Mike and Sarah, I don't know if either of you can speak more specifically if in previous legislative sessions. I know this past legislative session, I wasn't familiar with any particular accessibility bills that were introduced.
We were working on the Home Act passed this year, but we have Sarah, I think, can comment on Prince George's and Montgomery County. I think you guys do have some visitability legislation down there. It's on our target list now that we've got the Home Act passed. Yay, thanks to everybody who helped with that, because it was an incredibly long but successful effort. Sarah, what's going on down in your...
Yeah, of course, I'm not an expert on this, I have to be honest, because these are generally for private homes, and we just don't do a lot of work. It's not what our consumers come to us for. But there has been in Montgomery County for a while now a visitability if you do the modification to your home. So if you own the home and then you do some modification to create visibility, that there's a tax credit that can be issued. So that was the legislation. So it didn't force that to have to happen with new housing. It was if people were going to do modifications that it could. That's what I know.
Yeah, I'd like to get it done. I think it's really important that we build accessibility features into these homes. There's this big baby boom generation that, whether they know it or not, they're all getting older, and we are going to have to provide massive amounts of accessible housing, and we have to figure out how to do that. And it's not going to be through HUD and through federal housing specifically. It's going to be through private housing. And so we have to build both a list of carrots and sticks so that people who build homes are incentivized as well as told that they have to build accessibility features into new homes.
Is it okay to move on to the next question? Okay, so the next one is, can a nursing facility limit the amount of an individual's stimulus that they can request? For example, only $200 at a time.
Huh.
No. So an individual in a nursing home has the right to manage their own finances. So while I'm not sure because of COVID-19 if there's restrictions, and what funds are being on hand, but if someone is requesting access to their full stimulus check or however much money that's in their account, that nursing home should be making it accessible either through the activities department if it's making withdrawals to someone's bank account and assisting them with getting that done, or with the facility, depending on how that person's trying to access their funds. But there shouldn't be a limitation on the amount that they're accessing.
Okay, Heather, I'm going to ask you to unmute Nadine, oh shoot, I think she's on a phone number too. Nadine, I'm having trouble understanding your question. She said they're still having trouble with mail-in applications. Consumers are being told to submit forms online, and most of them don't have access or don't have the tech skills to do that on a computer. They've sent paperwork in the mail 2 to 3 times and are still getting threatening letters about submitting redetermination. So it must be with housing vouchers and so on, I'm assuming, subsidized units. Any help with that?
Well,
Go ahead.
and I would just like to confirm that it's housing, because annual recertifications could be with public benefits or.
Right. Hang on, let's see.
If you *6, if you do *6 on your phone, you should be able to unmute yourself.
Nadine, do you hear that? There we go.
Can you hear me?
Yes.
All right. So the issue I have is at least 3 to 5 of my consumers are older adults. They don't know how to use a computer. I've helped them fill out their redetermination paperwork. Sorry, I had ice in my mouth. And they keep getting letters back stating that if they don't comply by a certain date, they're going to lose their benefits. They've submitted the paperwork at least twice that I know of, but they're still getting these letters, which means they're not getting their mail, or they're not picking up their mail somehow. And these people are calling me all the time because they're stressed about losing their food stamps.
Okay, so my understanding right now is with redeterminations, benefits are not being terminated during this time, that benefits are being maintained during if someone is facing a redetermination issue. But if you're having if you're having a group of participants having issues, what I'm going to ask you to do is email me directly, and I can follow up if it's a particular office or again county that this is having issues with during the Thursday calls that we have with the Department of Human Resources. We have a contact there, and we can ask for some assistance with troubleshooting those issues. So I'll provide my email address to the group. It's Randi.
That would be,
Yeah, if you go ahead.
that would be great, because they get these letters and they're really stressed. And I'm like, well, you got until this thing is over, until anything's going to happen. But then they get that letter again and they're stressed. So thank you for that.
Yeah, no, and I understand when you're getting multiple notices, but again, it's just during this time, many organizations have extended benefits with regards to redeterminations. So, but in the interim, to connect with that person from the Department of Human Resources, my email address is Randi, R-A-N-D-I, my last initial A as an apple, and then at disabilityrightsmd.org.
Got it. Thank you.
I just put it in the chat box too, in case anybody needs to refer to it. Okay, sorry, losing my place here. Does Disability Rights Maryland advocate for accessibility on online platforms?
So since I've been at DRM, I haven't seen that issue come up, but part of the team I'm on is community inclusion. And I think if there's, whether it's a particular program or accessible issue, if it's a covered entity that's required to provide accessibility, that's definitely an issue we'd be interested in reviewing.
So should someone call your line to do that?
Yes, I would recommend it, kind of the specific information of the online platform that's not providing accessibility, and a little bit more information on the facts regarding what the person's needs are.
And the other thing is that very often accessibility issues have to do with blindness. So one of the organizations you should get in contact with is NFB, National Federation of the Blind, because they take on a lot of these accessibility legal actions, sometimes themselves through Brown Goldstein Levy, and sometimes with Disability Rights Maryland. So you might check that out, unless it's a different kind of accessibility issue.
Thanks, Mike.
Thank you. So I guess I'll insert one question here as we enter the next one, because I know I've had this issue from time to time when I've had consumers with various concerns that we're referring to Disability Rights Maryland. There are sort of priorities, and you talked about a lot of things that Disability Rights Maryland is working on, but I do always like to remind folks that you cannot work on every single issue. And so sometimes when we send, it can be frustrating, because we'll send a consumer thinking, it's a good issue, or, we'll say, well, should we send them here, or should we send them to legal aid? Do you have any advice when we're sort of supporting folks or making these decisions ourselves on where to call, or what do you recommend, Randi?
Yeah, I mean, we are always, even if it's something that we're not taking on for representation, we're always happy to give technical assistance and information and referrals. So if it's, the first question is always, is this a legal issue related to somebody's disability? And if you say yes to that, I think it's always worthwhile to make that referral to us, with the caveat that we may not be able to represent. Just for, as a point of reference, DRM, we have a staff of under 40, where Maryland Legal Aid has a staff of over 250 people. So that balance of being able to take on cases, sometimes we will make those referrals to legal aid or other organizations that we're aware of that work on the particular issue. So, I never want to dissuade someone from contacting us, and that's why I think it's just a matter of kind of, if it's an issue related to someone's disability, we would be the first. I would recommend contacting us again, because even if it's not representation, we can give some technical assistance, whether it's referring to filing a complaint at a particular federal organization with a particular federal organization, or to another legal services provider. And we're, and I understand the frustration, but we are happy to kind of filter those, because we are familiar with some of the other programs and their specialties. So I can't really say a blanket statement of, if it's this, legal aid versus us, or civil justice or Maryland Volunteer Legal Services, because it's really issue specific.
Right. Okay. Just wanted to kind of put that out there. We've had that.
And I appreciate that, Sarah.
So does Disability Rights Maryland assist with options waiver applications that were denied due to the expiration of deadline during the COVID crisis? I have a client that was denied, and he had submitted the application 1 month before the deadline due date. The supports planning rep is suggesting the client should reapply versus appeal the decision. And we may need to unmute Lisa.
Here.
There she is. If that question isn't clear by the way I'm reading it. Randi, do you need more information, or do you want to try?
No, yeah, no, I think that's enough information. So we do have our developmental disabilities team that will review a situation like that. I've seen issues like that come in with applications expiring. And with that, it may be advocacy with that supports person of getting them to advocate for an extension given the COVID-19. But that's definitely something we would be able to give technical assistance on and review if it's worth, or if we'd be able to take it on for representation.
Lisa, does that have enough information?
Yes, I was referred to legal aid after I had listened to your comments, and it makes sense because of the staffing. Do you feel like the response, Randi, is equal in representation between DRM and legal aid, as far as like the quality of, I hate to say that word, quality, but I need an advocate here for this person. Yeah. I'm sure a lot of people need them as well for their issues.
Yes, I would, I make those referrals to legal aid, and previously from working there, they have great advocates, and that's where sometimes it's just a capacity issue where someone may be referred. But again, I given the timing of it, I'd be surprised that there wouldn't be a way to make it an accommodation given with COVID-19, an extension for that application. But again, that would be better for someone to look at the facts and the particulars for that. So, I think your consumer would be, well represented with legal aid if they were referred there.
Okay. Thank you very much for this as well. It's very helpful, this whole presentation. Thank you.
Good. I have one more question on here. Do you have information about student loan debt for someone who's developed a disability and is unable to work?
So that would be one where I would recommend reaching out to legal aid. They do have more of a consumer consumer advocates, where I've seen just from being on different listservs, this is an issue that they've been interested in working on. So we don't have, I don't have resources handy. I know that this is a developing area with student loan forgiveness, especially with disabilities as well as going forward, but I would recommend reaching out and speaking to a consumer attorney with legal aid regarding that.
Terry, your hand is still raised. Did you have a second question, or do you just or did you just leave your hand raised? I'm not sure, and I want to be sure I don't miss anything. But we'll have to unmute Terry.
Does the executive order I spoke about earlier refer to nursing homes or simply hospitals?
So, and I would need to review it again. I can pull it up very quickly. Give me a moment. Because
that's the question someone else had for me. Mm-hmm.
Okay. Another one's popped up here. Since at this time we cannot go into a nursing facility to get an individual's signature, do you think a reasonable accommodation would be for us to ready the forms for someone and have us sign electronically for them? Read the forms. Okay, wait a second. I'm sorry. She changed that question in the middle. Woo! Let me try that again. Since at this time we cannot go into a nursing facility to get an individual's signature, do you think a reasonable accommodation would be for us to read the forms to someone and have us sign electronically for them?
And I'm sorry, this is someone with through the Center for Independent Living?
Yeah, this is a money follows the person staff at a SIL.
Okay, so I think it really depends on what the signature is requiring. As long as you have, obviously, as long as the applicant or participant gives you permission to do so. And then I know a lot of the applications have an area to specify if someone's assisted, to make sure that's just filled out, that assistance is documented. But I do, again, because we don't do too much work with assisting people with applying for services, but I think that would be within reason as a reasonable accommodation to allow for that, for another person, if the person doesn't have access to e-signatures, a third party to sign on their behalf. I think that would be a reasonable accommodation.
These are for waiver applications or county voucher applications. That's what we're talking about.
Gotcha. Okay. So yes. So whether that's just, again, if the application itself has a place to mark if someone assisted the applicant, otherwise I would either just include a letter or an informal document that just says this participant or applicant was assisted by this person, and with their permission, the e-signature was completed by the person supporting the person for applying.
Okay, last call for questions. Well, Randi, it seems you've done it.
I appreciate it. I hope this was informative and helpful.
I think Abiola has her hand up. Abiola has her hand up.
I did.
Well, Abiola, this is my staff now, so I get to be critical. Abiola, I didn't see your hand up. Why didn't you put your...
I did. I raised it twice.
Why didn't you put your question? Okay, anyways. Abiola, did you have a question?
It wasn't less a question than it was just a comment to Lana, who asked about the student loans. I actually have some experience with that. If the consumer has public student loans, in other words, they're not from Sally Mae or something like that, then they can apply, like the loans are through the U.S. Department of Education, then they can apply for NAILNET's total and permanent disability discharge of their student loans with a copy of their SSDI letter. My personal experience is that depending on the length of the disability, then you're going to get a break. They're going to put a pause or put your student loans in sort of like a holding pattern for about 3 years. And you don't have to pay a single dime. You don't owe any money. And as far as I can recall, they're not earning interest. But if, for example, the letter from the Social Security Disability says that the review period would be from anywhere from 5 to 7 years, then it is very likely that the student loan gets completely wiped away. Again, after the initial review period, or I guess call it, what is that period of time when you first start working for the first 3 months? What is it called?
Trial work period. And I would
the trial, yes.
So I was going to say that you could call your local Center for Independent Living, but I know we're also overwhelmed at the moment. I didn't want to necessarily completely volunteer but as Randi made another good suggestion on a place to get information, but that's definitely a question you could call your local Center for Independent Living, because I know our staff have, as Abulis, have expertise, and we have certainly been through this sometimes with our own staff before. So I definitely encourage you. Abula, will you look in that chat box and answer Lana's question, please?
Yeah, I've just put it the website where people can apply.
Good, thank you. And then
quick just comment, Sarah. I actually went through that process myself, and Abiola, it may be 3 years that they do that, but the minute you start working, even if it's part-time, you get a letter, because I was on that hiatus for 12 years. And I started working 1 month after I started working, they sent me a bill. So.
But there's a maximum, just like everything else, and I don't know, we want to get into all these details today, but there is a maximum of how much you can earn, Native.
Yes.
So as soon as you cross over, just like any other benefit, right?
Right.
If you cross over that,
I think it's $16,500. Once you go over $16,500 a year, then you can expect that you've sort of triggered it to go back into the repayment.
So if you're working at all, you just need to be aware, that there are limits on, make your own choices about how you handle that. I'm not going to advise it. But then there's someone asking about the end of the trial work period is coming during the shutdown, and that you have IRWs and don't know how or where to submit them. I don't think that's probably a Randi question. I'm going to, again, if it's okay with you, Randi, encourage this person to contact their local Center for Independent Living. We almost all have benefits counselors that work for us. And so we can certainly help and answer that question. And it doesn't necessarily have to be a benefits counselor. Most of our independent living specialists know how to support people on that. So
you probably need to create a page that shows all of the Centers for Independent Living and their contact information, so that we can put that up each week, so you'll have it.
Well, yeah, I think Katie was going to do that. Yeah, let's do that. Let's make sure we do that next week. But if
everyone that registers sees that both on the registration site and in the acknowledgement letter.
They see which counties we each serve?
Yes, every participant in IAM is posted.
Okay. So you can see which Center for Independent Living you could call. And if you call the wrong one, we're just going to, we'll direct you to the right place if anything happens. Okay, so there's also the Ticket to Work hotline can often answer questions like that as well. I think we've got everything. Randi, did you have any closing comments?
Just one thing, I wanted to go back to Terry's question regarding the order regarding visitation. So it is particularly just for hospitals, because I know right now at nursing facilities, there's a lot of issues going on with individuals not being able to receive visitors, but I just wanted to clarify that that order is specific to hospitals for visitation.
Thank you.
Okay, that's everything. I know Lori's going to close us out. Lori, do you want me to just mention first the speaker for next week, and then I'll just turn things over to you? So we just want to remind folks, and of course, you can join the IM list, and Abe can maybe refresh us on how people can do that. Most all the Centers for Independent Living in Maryland have it posted on their Facebook pages. So we invite you to go to our social media and join things, or you've received emails and you need to register, for each session so that you get that week's login information for Zoom. Next week, we're featuring Maureen Van Stone, who's the Executive Director of the Maryland Center for Developmental Disabilities at Kennedy Krieger. And, sorry, I'm getting a weird message there. She's going to speak about dignity in healthcare. She's worked with a group that has recently developed a document for people with disabilities on dignity in healthcare. You'll get more information in the next couple of days, but just to mention it. Go ahead, Lori.
Okay. Well, again, I'd just like to thank everyone on behalf of all of the Centers for Independent Living. I think this was a very informative session, and I know as I was taking notes, I was kind of like just taking it all in. So thank you, Randy, for all of that information. Again, this will be posted on YouTube, so you can go back and refer to it again, or invite other folks to listen. One of the things that I would like to say is that in order to keep a really good program like this going, we do require funding. So if you can contribute financially, that's awesome. It is an option whenever you register for a session. So Abe, do you have any specifics you want to say about that? No?
Who are you talking to? You talking to me?
I said Abe.
Oh, Abe. Oh.
Yeah. Yeah.
Abe, are you still there?
Yeah, but Mike, go right ahead.
I think you said it pretty well, Lori. We're all nonprofits. We're in your communities. We are organizations run by people with disabilities. I was pointing out to somebody the other day that there's really only one national service organization that serves people with disabilities by people with disabilities, and that is Centers for Independent Living throughout the United States. We're each separate. We all do our own thing, and so each center is a little bit different depending on the community and the needs. But we definitely depend on your funding, and if you have an opportunity and have some fund available, please remember us. Thank you so much. And thank you, Lori. You did a great job.
And a big thank you to Randy for
Randy,
all your
yes,
time and to Disability Rights Maryland in general, because we turn to you all the time for important legal questions when we don't know something, or we're playing a little too much of a lawyer on TV and need some real actual lawyer information. We always turn to Disability Rights Maryland. So thank you all so much.
Everybody have a good afternoon. Thank you. I guess we didn't really, we had announcements at the beginning, didn't we? That's right. All right.
Did.